All right, let's head on to our first conversation now. We have a fresh debate that's emerging over taxation, public health, and the future of Nigeria's manufacturing sector. Following the Senate's passage of the Sugar-Sweetened Beverage Tax Bill, supporters of the tax argue it could help reduce the growing incidence of, diabetes and other non-communicable diseases linked to sugar consumption. While critics insist the timing is wrong, especially as businesses continue to battle inflation, high energy costs, foreign exchange pressures, and weak consumer purchasing power. The debate now raises broader questions about balancing public health objectives with economic growth, investment protection, and industrial sustainability. Well, joining me for this conversation, I have Dr. Muda, Yusuf, CEO, Center for the Promotion of Private Enterprise, and he joins me right here in the studio. It's great to have you on the show, sir. Good morning.
Thank you, Larry. Thank you very much.
So, I'm looking at this sugar tax. Current one, that's 10 naira.
10 naira.
That's the
per liter.
Per liter. Yeah. 10 naira per liter, that's the tax.
Yeah.
And that's payable, by the manufacturer.
Yeah.
At this point. And if we look at, so percentage, now they're looking at a new structure. A percentage-based tax on retail prices. So what percentage are you hearing?
Well, there is no specific percentage
So it could be
yet.
10, it could be 20.
It could be 20. And the whole idea is to increase the cost of these non-alcoholic beverages. And the argument here is that these costs are already high. An average soft drink now is between 400 to 500 naira per bottle. This used to be around 300, 200. So costs have gone up between 100%, between 50% to 100%. So if you are talking about wanting to tackle diabetes, it's not about imposing additional burden on consumers. Yes, we can address issues of diabetes.
So the cost, technically, this tax is supposed to take the cost up.
That is the objective.
Right.
But to take the cost up and generate revenue.
Yes. But without the tax increasing, the cost has already...
The cost has already gone up. All of us are familiar with the inflationary situation in the country.
Right.
The cost of production, the pressure on manufacturers, energy costs, foreign exchange, interest rates, all these logistics costs. These costs are already heavy. And in any case, let me also make this point. Already there's a lot of taxes that are being paid. These companies pay 30% company tax. They pay 7.5% VAT on a whole lot of issues. They already pay 10% per liter on these non-alcoholic beverages. There is 4% development levy on accessible, profits, as a result of the tax reform. All those NIDA tax, police trust fund, theft fund tax, everything has been consolidated now, which is 4% on accessible profit. It is 4% on pre-tax. Then you have, of course, import duty that you pay on a lot of, some of the intermediate products, which ranges between 5% to 15%, depending on the nature. Then you have the 4% FOB. FOB is the cost, total cost of the things that we import, which also has to be paid on practically all the imports that these manufacturers get. Then there's 0.5% ECOWAS levy. So if you have all these taxes, we haven't talked about subnationals, so we haven't talked about NAFDAC, SOM. This is just at federal. So if you are talking about, easing the cost of doing business, and in any case, even the tax reform, the whole objective of the tax reform of Mr. President is to reduce all this pressure of taxation, both on businesses and on consumers. That is the whole lesson. If we have that, and we have the kind of situation we have in the country, is it the time for the Senate to be coming up with a bill to increase the cost of non-alcoholic beverages because you want to fight diabetes?
Okay.
I think we believe that there are better ways of dealing with this.
All right, so looking at that 10 naira per liter levy,
yes,
that's on most of these soft drinks.
Yes.
So if we look at that 10 naira now, at the current exchange rate,
yes,
that's less than a cent. You can put that up for me. So 10 naira, that's about 0.007. That's in dollars.
Yeah.
So it's really been diminished so far.
It has been diminished.
Not 10 naira.
But Ladi, I mean, we are all in this country. Is it even sensitive at this time for anybody to be contemplating an increase in tax? I mean, the president was very clear in the process of this tax reform that this is not the time to increase tax. This is the time to ensure that we have better tax administration, better tax compliance. The whole idea is even a complete negation of what the president has been saying. And in any case, if you want to tackle diabetes, is it the best way to tackle it?
Raising taxes.
Yes, raising taxes. Because, I mean,
where does the tax go, really? Well, if you're raising tax to
part of
tackle,
the argument,
yes.
Part of the argument of the Senate, or those who are proposing the bill, is that some of the proceeds will be going to the health ministry, so that they can use it, to deal with issues of diabetes and all of that. But the bigger issue is that if you are really sincere about tackling diabetes, is it not about addressing issues of lifestyle? Is it not about issues of dieting, about education? We eat a lot of carbohydrates. You are not talking about sensitizing the citizen about how much eba or fufu or pounded yam or rice that they should be taking. Our diet is heavy on carbohydrates. That is where the bulk of these things are coming from.
I hope we don't get a carbohydrate tax, though.
Well, that is the way we are going. Then you have issues about sedentary lifestyle. People are not moving around enough. Then you have issues about urban planning. Because there's a way you plan your city so that people occasionally can decide to ride bicycle to work. There's a way you design your city so that people can decide to walk. Now, if you want to take a walk now around anywhere, the fear of Okada and all of this, we see some people trying to jog here and there. We know the hazards around this. These are fundamental issues that we should be addressing. This is not the time to be imposing additional tax. And in any case, we have the 4% development levy. And the whole idea of the development levy is to consolidate all these pockets of taxes. Everything has been brought under that umbrella. So if there are issues of national priority, it can be brought under that development levy, and they share it. Because already part of the development levy is going to cybersecurity, part of it is going to tertiary education, part of it is going to technology development, part of it is going to NEL fund. That is the whole essence, so that you don't have fragmented pockets of funds here and there. That is why the whole thing has been harmonized. So this idea of the Senate coming up with a different fund they want to set up and imposing the burden of that on consumers and on businesses, I mean, it's not right. It's not proper. It's not appropriate.
So looking at currency devaluation so far, do you think there's a relationship between when a local currency has been devalued over a long period of time and the level of tax payable? Is there a relationship there at all?
Well, there may not be any serious relationship. And why I'm saying that is that I just read out the number of taxes. These taxes are percentages. They are not nominal like we have with the 10 naira per litre thing. They are percentages. So as your nominal income increases, the amount of tax you pay increases. All of those things are percentages.
All those other taxes increase?
Yes. And even for this 10 naira per litre, yes, you may say that over time inflation has had some effect. But the finance ministry has a framework of being flexible in dealing with taxes. They have a framework in dealing with import duty. They have a framework in dealing with excise tax, depending on prevailing circumstances. So we just leave it the way it is. If the executive feels or the finance minister feels that there's a need to adjust, they have that discretion to be able to adjust it. Not to tie the hands of everybody by now putting this in a bill and saying that we should move from what we call specific tax. Because when you give a tax, nominal terms, in terms of the litre, like 10 naira, that's a specific tax. When you make it a percentage, that's ad valorem. Now, even for many of the drinks, like alcoholic wine, they have specific tax of almost 70 naira per liter. They have ad valorem of over 20%. The same thing with whiskey. It has ad valorem of almost 30%, specific tax of almost 80%.
So I guess all the sin taxes are...
They're already there.
They're there.
Yeah. To now classify poor people that are struggling with bottle of... Because for some people, once they have a bottle of this soft drink and they have bread, they are good to go. When you now clamp down on them, because invariably, this thing will increase the price of all this.
So there's no other direction. Once we see a particular tax rise, there's no other outlet. They're passing it on to the consumer.
So it will go to the consumer. And in any case, over the last 2 years, demand has dropped. That is what industry statistics is telling us. Because people are also struggling with some basic things. The purchasing power has declined. Demand has dropped, significantly over the last because of cost. I mean, soft drinks that people are buying at 300, it is now 500. So even automatically, the prevailing economic situation had diminished the capacity of the average Nigerian to buy these things.
All right,
That's not to diminish the importance of this public health issue, but it is more about sensitization, not about imposing taxation.
Let's imagine, all right, it becomes law. At this point, it's no more the specific tax. What does this mean for jobs?
Well, it has negative implications for jobs. Because if you look at the non-alcoholic space, they have extensive value chain. From the production to the logistics to the retail. Every corner you go, you find these non-alcoholic beverages. So if demand drops, that has implications for those who are in the entire value chain. It has implications for manufacturing capacity utilization. And we are talking about trying to create jobs and all of this. This is not something that is good for job creation. This is a time we should be looking at how we can bring down the cost of doing business, how we can bring down, challenges that people are facing with purchasing power. So it has very adverse implications for jobs across the entire value chain.
So how is it done in developed economies at this point, or our African peers now? How do they handle their own sin
Well,
taxes?
I think they do a lot more about sensitization. Some of them go along this line that we have just said. They have specific tax. Some of them perhaps also have this ad valorem. I don't have the full details of that, but there are various models of dealing with it. But in our own situation here, we consume a lot of carbohydrates for breakfast, for lunch, for dinner. Those are bigger issues when it comes to risk factors in diabetes. That is where the emphasis should be. So that is our own position. It's not about clamping down on industrialists or something, to ensure that they now increase the cost of this. In any case, what you can properly even regard as this sin tax. I mentioned whiskey, I mentioned alcoholic wines, I mentioned cigarettes. These things are already attracting heavy taxes, both in terms of the ad valorem tax and in terms of specific tax. So to a large extent, we're already dealing with those things. So for now, I don't think it's sensitive, in fairness, and with due respect of the Senate, to pass a bill at this time, of all times, that will increase the cost of basic things that ordinary people
I guess
consume.
a good time would be when consumer demand improves. What would be a good time, really, for this?
Well, I wonder whether if consumer demand improves,
right.
If the poverty
that should be a good
situation,
sign.
If the poverty situation
reduction.
increases, if things get better, then we are still struggling to recover from the burden and the costs of the reforms. The president has been concerned about this. That is why it was particular that no tax should, the regime will not going to impose any additional tax. It's about being sensitive to the conditions of the people. We are talking about how to translate the benefits of the reform to welfare impact. That is the stage we are. The government has managed to stabilize the macroeconomic environment, but we are still struggling to connect the stability to welfare, to consolidate, to ensure growth, to improve the welfare of the people. That should be the concern of both the legislature and even the executive. So we are where we are. It has been passed by the Senate. Our appeal is to the House of Reps, because there's need for concurrence of the House of Reps to have a rethink about this and step it down, at least for now, so that at least the citizens and the ordinary people can have a breathing space, while we focus a lot more on the larger issues affecting diabetes and other, non-communicable diseases, by way of ensuring better awareness, better education about what we eat, about lifestyle, and all these things. Those are the things that should engage our attention at this time.
Right. I guess we have a government that doesn't just care about raising revenue. They also care about our health.
Exactly. Of course. Of course.
And it's fantastic.
Of course.
To care about the health of Nigeria.
Yeah, it is fantastic. But we should vote more. I mean, we have the 4% development levy. Let us give part of it to the health ministry. Let us reorder even the budgetary allocation to ensure that we invest more in health, we invest more in security, we invest more in education. We have the tax reform. Tax reform is likely to improve the revenue. Economy is growing. We are allowed to see more revenue. Some of the states are making more money. Let them invest a lot more in all these critical areas.
All right.
We'll get more value from that.
Let's all, try to, make sure we're healthy.
Exactly.
At this point, so we don't have too many sin taxes.
Exactly.
At this point, thank you so much. Dr. Muda Yusuf, CEO, Center for Promotion of Private Enterprise. Thank you so much for coming this morning.
Thank you very much, Larry. Thank you.